myself. We've had a discussion. It's a 45-year-old male who's agreed to do this assessment, and it's in a private area. Are you comfortable? Any discomfort? Okay. So we'll proceed then. We have also had a discussion of his health history already, so I do have a little idea of some of his previous health conditions. So at first, we'll go ahead and start by hand washing. And at this point, I will obtain a set of vital signs and go ahead and document those, but we'll forget that. We'll just assume that was already done. Do you appear to be age appropriate? 45 years is your stated age, and you do appear to be that age. Level of consciousness appears to be oriented ×4, and no issues there with forgetfulness or concerns. Okay, so his nutrition and his posture appear to be appropriate. Posture's nice and straight when you're standing. I have watched you ambulate. You ambulate very adequately without any needs for assistive devices. So no issues there. As far as sitting and standing, you can do that with pretty much ease, I'm assuming, because it looked like you were able to do that for us. Okay, for hygiene and your dress, looks like you're dressed appropriately for the climate, and you're able to provide for yourself for your hygiene, proper hygiene. Height and weight, you're 5'10", said about 205 pounds, correct?
Right.
Okay, so no issues with appetite or that sort of thing. Okay. All right, so we'll start with looking at your skin with your hands. And look at the backs of your hands as well as the front of your hands. Okay, and I'm going to check for capillary refill here. Okay. Looks appropriate. Okay, so it's about 2 seconds, so that's perfect. That's what we want. And then we'll go from there to checking your scalp and your hair and your face. So I'm going to palpate your scalp. Any tenderness or, okay, skin appears to be appropriate and well distributed. No hair to evaluate, although there is facial hair, which is even and symmetrical. Eyebrows look to be even and symmetrical. Can you lift them and drop them? Okay, so they're working in unison. All right, and I'll assess your temporal artery pulse. Okay, that's about a +2, and your temporal mandibular joint, if you can lift or open your mouth and close it a couple times. Any clicking or discomfort there? Okay, so no issues there. Can I assess your sinuses now? I'm just going to press in a little bit. Do you have any tenderness there?
No.
Okay, the sinuses are intact. So the next system we'll go to evaluate will be his eyes and his vision. I would, in evaluating you before, our discussion before we started, you had told me that you had LASIK surgery a number of years ago. So you do follow up with your ophthalmologist pretty regularly then, and your vision is?
2015.
Okay, perfect. Okay. So I'll go ahead and forego the Snellen chart way of checking his vision at this time, since he does have it checked pretty regularly. If we were to do the Snellen chart, I would put that against the wall and then have you step away for about 20 feet. And then I'd evaluate both eyes as well as each side separately. All right. I also do not have an otoscope, which I would use to check for red reflexes as well as the inner eyes. And but we're going to go ahead right now and check for confrontation by peripheral vision. Okay? So if you can sit up and cover the left eye with your left hand and tell me when you can see my fingers come into view.
Yeah.
Okay?
Yeah.
Okay, we're going to do the same with the other side.
Yeah. Yeah. Yeah.
Okay, perfect. All right, so from here, we're going to check through 6 cardinal gaze positions. We're going to use the pen, okay? So if you're a pencil, you'll just focus in on the pencil tip, eraser there, and keep your head straight forward, okay? All right. All the way in. Okay, super. All right, so that shows to me that his extraocular musculature is working appropriately, which tests the cranial nerves 3, 4, and 6. The external eyes appear to be equal, eyebrows equal, eyelashes, sclera are equal, and the conjunctiva, as well as the irides, and your pupils. So we're going to check the pupillary reflexes with a pen light, okay, coming from the side. Okay. So those are working appropriately. All right, so from here, we're going to evaluate your ears. Okay, so I will lift the auricle and just to look at the exterior, do that from one side to the next, and with the light, and then I'm going to lift the auricle and I'll be gently palpating. Okay, any tenderness there? Okay, that's the tragus that I'm pressing in gently on. Okay, and I'll do that again on this ear. Any tenderness? Okay. And then if I had a otoscope, I would gently insert that while I'm telling you ahead of time into the ear canal to evaluate the ear canal as well as the tympanic membrane or eardrum. Or any kind of debris or any waxy buildup or any objects, or if there's any drainage or redness. Okay? So at this point, we will go from, I'm going to check the hearing test because I would normally check the Weber and the Ren test with a tuning fork, but I don't have a tuning fork to use for this assessment today. So we'll go ahead and do the whisper test. Okay, when I say a word, if you'll listen and tell me what word I'm whispering, that would be great. Okay?
January.
Okay, good.
Easter.
Okay, good. All right. So we're good to go for his hearing. We'll check your nose now. If you can look, you're symmetrical, that's good. All right, and can you occlude one nostril and breathe for me? In and out. I do the same on the other side as well. Okay, no problems there? Okay. And I would use the light to tilt back gently and check both of his nares. No occlusions or problems there. So, all right. So that's where we would complete the inspection and the evaluation of the nose. Now we'll go to the mouth and throat. I'm going to have you open your mouth, okay, and stick your tongue up and down, okay, on the sides, side to side, okay. So dentition and gums appear to be intact, pink, and moist. We'll go ahead and check your uvula, the speculum. All right, you can stick your tongue out. Okay, so his uvula is moving appropriately, which that determines his cranial nerve 9 and 10. Now I would also check his gag reflex, but I think we'll forget that this time, okay? But I would go ahead and check if you stick your tongue out for me, okay? And then that's pink and appropriate. That is checking the cranial nerve number 12. All right, next we'll move to the neck. I'm going to inspect your neck. Looks like it's even, no discoloration, any lesions or bumps or tenderness. I don't see any evidence of that. Okay, so I'm going to check your cervical lymph nodes, any tenderness or swelling. I don't feel any. I'm going to check the supraclavicular lymph nodes as well as your infraclavicular lymph nodes. Okay, I don't feel any tenderness or swelling there. And so I'll go ahead and check your carotid pulses one at a time so we don't make you dizzy or lightheaded. Okay, and those are 2+, both of them on both sides and equilateral. From there we'll check your trachea, the midline, and that's midline and appropriate. Okay, and then I'll come around here and I'll have you swallow for me. What I'm checking is his thyroid. I don't feel it, so that means that he's in good stead, so no issues there. All right, from this point we're going to check your range of motion for your neck. If you will, turn your head side to side, down, chin to the chest and back. If you can do a circular. Okay, so that's very good. And then I'm going to have you do the shrug test, which is resistance. Push against me. Okay, again. Very good. All right, if you can push against me with your head. Okay, the strength appears to be pretty strong and equal, so that's wonderful. All right, so the shrug test and the head resistance is checking his cranial nerve number 11. Now I'll have you stand, if you will, and if you don't mind, remove your shirt from me so I can evaluate your thorax. All right, so I'm going to start with checking his front symmetry, and then sides, as well as his back. And that right there is checking his AP and lateral ratio, which is 1 to 2, which is the normal ratio. I'm going to auscultate and listen to your lungs. Okay. Okay, nice deep breath for me when I move the stethoscope. Okay, very good. All right. So from there, I'm going to lightly palpate any tenderness or issues that you want to let me know about, any pain. Okay. All right. Now at this point, I'm going to go ahead and check his tactile fremitus. By doing that, I'm just going to put the palm of my hand across his lung fields, and if you can say 99 as I move my hand. Okay. 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 Okay, very good. So that seems to be appropriate, top and bottom. I'm going to go ahead and percuss now. Doing so, I'm also going to check the CVA for tenderness down here. This red border. Do you feel any tenderness there? Okay. Red border. Any tenderness there? Okay. very good. No tenderness. All right, so next step we're going to do is we're going to check for your excursion. If you can take a deep breath for me. Okay, that's good. So that's very symmetrical excursion. And next we'll check your anterior chest. So if you turn around, we've already looked for symmetry. These are nice easy breaths. So I can evaluate your thorax rise and fall with breathing. Very good. I'm going to palpate. Any problems? Okay. All right. And then I'm also going to check your lymph nodes, axillary lymph nodes. All right. Okay, no tenderness. I don't feel his lymph nodes, so they're healthy. And then at this point, I'm going to go ahead and listen to your lung sounds from the front. Deep breath for me. Okay, nice and clear and appropriate. All right. While I'm listening to your front, I think I'm going to go ahead and listen to your heart sounds as well. We'll start with checking the aortic pulmonic area. Okay. And then also the Irvy's point. Okay, and I check the tricuspid. As well as the bicuspid, also called the mitral valve. Okay. Rate and rhythm are regular and strong. I'll go ahead and palpate right here the apical impulse. Okay, very good. And then we'll check for tactile Hermetis. Say 99. 99. Okay. Okay, very good. So the resonance is apparent and good. Would at this time instruct you to pay attention if you have any kind of lesions or bumps or tenderness in your chest tissue, because men can get breast cancer as well. If you have anything like that that might be a concern that pops up, then follow up with your primary care physician. Okay? All right, so from here we're going to go ahead and evaluate your abdomen. So I'm going to have you have a seat. Step back, if you will, put your feet up. All right, so I'm inspecting. His abdomen appears to be intact and symmetrical, no issues there. So I'll go from there to listening to all 4 quadrants for vowel sounds. Okay, and those are audible. Now we'll also like to listen to see your aortic, abdominal aorta. Okay, I don't hear anything, so I wouldn't be concerned for with the brewing. Percussion. I'm going to go ahead. That's all 4 quadrants. And then I would do light palpation. Any tenderness there? And do deep palpation to find the lower border of the liver. Okay. And then I would try to do deep percussion for the spleen, but I don't feel the spleen. So that's a good thing. We don't want to feel the spleen. All right. So at this point, we'll go ahead and check abdominal reflexes. And by doing that, just going to, yep, it does have response. So that's a positive response. And we'll go from that to checking the femoral pulses. So I'm just going to check right up in here. Okay. Okay, and those are 2+. So as far as, and strong. So as far as his pulses and reflexes abdominally, those are appropriate. We'll check his extremities now, upper extremities. You can go ahead and bring your feet down. Now check your radial pulses. Okay, that's equal and regular. Brachial pulses. Equal and regular, 2+, both. And then we're going to check this on through grasps. We can squeeze tight. Okay, those are equal and strong. And then we'll go from there to check his popliteal pulses. Oh, excuse me. Okay. Those are equal and strong. I'll check his tibial pulses behind his, on his ankle there. And then check his dorsalis pedis pulses, and they're both equal and strong, 2+. So, all right, at this point, our pulses are good and strong, 2+ normal, and then we'll check reflexes next for deep tendon reflexes. All right. You just relax that. Okay. All right. And I'm going to check this brachial reflex. All right. Good and strong. 2+ so far. I'll check your cubo reflex. Just the elbow. Just let your hand, your arm dangle. Okay. Okay. And come around and check your other. Alright, just let it dangle. Alright, good. Alright. Okay. And so far we're doing pretty well with your deep tendon reflexes. The next one we're going to check is your, I'll have you sit down. Oh, you are sitting down, sorry. I'm going to check your knees, but you're just going to have to let your leg dangle and let me support your knee, okay? Awesome. Reflex. Okay, again. Oh, good. Okay. All right, so that's good, and now we're going to check your Achilles reflexes, but I'll have to have you lift your feet up at the back. Just like so. There you go. And bend it over just like that. Just relax. Good. All right, let's try the other one. You're good. All right. All right, while we're at this point, we're going to go ahead and check your hip flexion, okay? So if you can lift your leg up, okay, and down. The other one as well, okay? All right, now let's cross this leg over and bend it really well. Very good. Okay, can you try the other one as well? Marvelous. Okay, good. All right, so at this point we're going to check the Babinski reflex, which is negative. So that's a good place to be. All right, so we've done the hips. Now we're going to have you stand up and we're going to check your knee flexion, range of motion. Okay, and I'll have to hold you. If you can, bend your knee and out, back, okay, and then the other one as well, out and in. Okay, super, you did very well. While you're standing, we're going to do the Romberg test. If you'll stand with your eyes closed, then I'll count. I'm going to count 10 seconds. How are you doing?
Good.
Okay, so let me go ahead and have you sit down, sit back in, you can open your eyes now. And we're going to check your ankle range of motion. If you can, just lift your foot up and then out and side to side and all around. Yes, perfect. And you do the same with your other one as well, please. Up, down, all around. Good, nice flexion. Okay, the range of motion. And here we're going to check your shoulder range of motion. So if you can, please put your arms forward, backwards, and then make round circles for me. Perfect. Okay. Very nice. From there, we're going to check your elbows, see your range of motion with your elbows as well. Bring it forward, extend, and then just if you can, okay, that's fine. Then we'll go from there to the wrists. If you can, just up, down, and then pat, 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 okay? So mobility and range of motion appear to be intact. From here we're going to have you close your eyes, if you will, please. And I'm going to have you do the finger to the nose, the tips of your fingers to your nose, okay? So if you can just do that with your eyes closed. Perfect. Okay, very good. All right, so you have pretty good sensation there, and we'll just go from, keep your eyes closed at this point, and I'm going to place objects in the palms of your hands, and I'd like you to identify those for me, if you will. Okay, can I have that hand? Thank you. All right, I put it in your hand. You determine what that is.
Toothpick.
Yes, very good. Okay, let's have your other palm up. Let's see if you can identify that object as well. Okay, what shape is it?
Round.
Border, very good. Thank you. All right. From there, we're going to assess the, actually that was a stereognosis, is intact by being able to determine the shape with his eyes closed. This part we're going to determine or see if you're able to determine sharp versus soft. Okay, tactile sensation. Can you tell me what that is?
Sharp.
How about this?
Sharp. 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 Soft. Soft. Sharp. Soft. Sharp. Soft. Soft. Soft.
Okay, very good. All right, at this point, it looks as though his sensation is relatively intact. There were a few times when he wasn't able to provide the correct answer, but that's okay. We're going to forego the reproductive system and the genital organ evaluation at this time for this assessment, but we would normally do that. And then at this point, I just want to ask you if there's any questions that you may have or concerns that you'd like to discuss. Okay. So if anything changes in the next, however, then you can just follow up with your primary care physician. Okay. Okay. Thank you, sir. Okay. And that completes our assessment for today.